Good evening, ladies and gentlemen, and a warm welcome to you all. My name is Naomi Brown, and I am a part of your hosts this evening, or wherever you are in the world. And I am a business consultant and transformative mindset coach. And I'm here with my partner in crime tonight, Mr. Shaukat Ahmad. And he is a leader when it comes to innovation. He's a conceptualizer, an entrepreneur when it comes to empowerment and leadership. And these are really prominent themes that we need in today's world. And today we're going to be looking at a topic which has not only just affected some of us globally, but has affected us all in some sort of way or another. And that, of course, is COVID-19. Now, myself, I have very close personal experience with COVID-19. I unfortunately was quite sick back in January with this. So today we're going to explore what this has meant in terms of business and what we can do to really survive going forward as we kind of come out of restrictions internationally and look at things in a very kind of different aspect. So Shaukat, it's lovely to see you again this week. How have you been?
Lovely to see you, Naomi. It's been so many days, and it's always a pleasure when I'm talking to you and on different subjects, and it really energizes my soul and gives me the inspiration to speak on anything that is currently, in need our society and the society norms. Yeah, it's lovely talking to you.
So absolutely. So, we always kind of look at different topics on each week, and of course this week we're going to be looking at COVID-19 and what that has meant for everyone. So in relation to business, do you feel it has been one of a help in terms of resilience and how we plan going forward, or do you feel, of course, it's been a hindrance?
Well, honestly, COVID-19 is it's an unfortunate that hit our lives badly, and we kind of were not ready to face it. And if you ask me, based on the research I have done, because I do a lot of research, former business, research has been a part of my life ever since I started working. Now, the kind of observations I did, and the kind of the cases I read about, and the scenario which is going on from last one and a half year now, I don't think it's any help to the entrepreneurs or to business entities or to any individual or to a group of company or to business. It's been definitely a hindrance, and this has badly hit the global economy. And if we talk about the unemployment, I mean, it's really been a very bad thing, and it has stopped. I mean, when you are not being able to afford the rent, you're not being able to get an education or visit a doctor or to care for yourself and your family, and then you have the unemployment stuff, and we any ramifications, and this is something which definitely has been bad for any kind of business we have. I was reading an article a few days ago that was broadcasted by the International Monetary Fund, and they say that we lost more than 495 million people have lost their jobs, and these are the people who had the full-time job. So 495 million, it's huge. It's huge.
Yeah.
Okay? Well, I wouldn't say 495 million is the full-time. I think it's mixed, because 5 million is the full-time job seekers. I think the full-time job seekers, I think this is mixed, but 495 is still a huge figure. And they still say that if the COVID wave hits us again this time in the second or the third quarter of the year, there are going to be more than 150 to 200 million people losing their jobs. Mm-hmm. So I think definitely it's not a kind of a lot of people on social media, especially these you call them these online coaches, and they do some kind of stuff, and they mention that, okay, we enhance and we galvanize people, we help them to earn 6 figures, 7 figures sitting at home and stuff. They seem to be enjoying it. But if you ask me in general, that's not going to help.
Yeah,
something definitely been exhausting.
Yeah. I completely agree with you. And when we look at it kind of, within the UK, there's been a kind of rippling effect. People have, work in physical space such as hospitality and, the travel and tourism sector, in the UK, for all that to have ceased for so long, which has had an impact. Then people have lost their jobs, which is then putting increasing pressure on other free services which we have in the UK, like our health service. So it has that absolute rippling effect, and then of course it affects, a knock-on effect globally for us as well. So absolutely see from the perspective of coaches online, there is a lucrative industry there for people to start cashing in on, but then it leaves that it's not always incredibly well regulated. In the UK, there's no regulation really in terms of online coaching. So you maybe have people that are then practicing unethical kind of standards when it comes to it, because they haven't got enough skill set or, professional qualification to entertain, a successful business with meaning. So absolutely, you can see it from both perspectives. For me, I was one of those people who had been placed on furlough. I had a team. I worked as a business manager in the international beauty industry, and my team were all effectively made redundant. And you were still doing the workforce of 5-6 people. So for me, it made sense to utilize my skills in a different sense. But not everybody is me, not everybody is you. So you have to really look at it kind of as the collective, and really kind of look at it. It affected all types of business during these times.
Yeah, I completely agree with you. Well, let's see. The point is that we have been there. We have been trying to get digital and make this whole world and compact it in a small box. This is what we have. Mm-hmm. And this was the right time. I don't know when we say that man proposes and God disposes. This was the right time to try firms and big companies to try if we can go digital. I personally don't think that can compact the world in a box. We can't do everything from home. Personally, I think that people-to-people contact is a must. There is nothing. You have different views of the different scholars and different expertise, different experts speaking based on their expertise, that we can digitalize everything. Yes, we can, but not everything. We can't control the world. We can't control humans. We can't control the human activities. We can try. Exactly. We can try. When people say we want to get digitalized, we want to do everything sitting in our bedroom, just lying on bed and keeping the laptop and phone and controlling things, controlling people, it doesn't work. No. This is what God showed us, the example. Now we have been under isolation. Let's say we have been sitting kind of quarantined since last February, and then how many people could reach the people. Business entrepreneurs could express their business to the people. How many companies could run, their management could run their operations sitting home? How many? 10%, 20%? So what about 10%? If we could digitalize everything, then we wouldn't have more than close to 500 million people leaving, losing jobs. Mm-hmm. We can't digitalize the whole world when you have the vendors, the hawkers, and the street sellers, and those people making money only when they go out, they meet people, they interact, they sell goods.
I agree with you, and our business is as part of our consciousness and who we are. It's an extension of what we do. Now, if we are confined to the household where we're, in this digitalized age where we're connecting over Zoom, at the moment. But again, how can you actually fully embrace someone's emotion and engage in a really longing, meaningful relationship with your customers, with your clients on long term? It is based on that human contact and an understanding. But then we look at the workforce as well. You know, we're hearing about, you know, Zoom fatigue is a real thing. You know, you're having to effectively only see part of your workforce in their personality. So, you know, it's becoming quite draining being at a computer screen engaging, because the body, the mind and the soul, it craves to actually have attention of, you know, relationship building and rapport, you know, within your workforce, within day-to-day life relationships as well. So absolutely.
Yes, exactly. And second thing, when we say, you know, not meeting people and, you know, how this business is going, how this whole thing, the COVID-19 is going to be keeping us people. Well, statistically speaking, if you have a look at in the past, in the history, and epidemics and pandemics with at least 1 million deaths worldwide, there have been so many, you know, pandemics that came in the past. But if you see the ones like Spanish flu, then you have HIV/AIDS, then you have the plague pandemic, then you have the influenza pandemic. These were, then you had the Hong Kong flu. We had like 5 to 6 pandemics. They came, they hit globally, and I'm talking about the people where there were at least 1 million deaths. If you see Spanish flu in 1918, it remained for 2 years. It ended in 19. Mm-hmm. It took 17 to 20 say that 100 million deaths.
Yeah, but we look at, you know, so we look at global population. So the Spanish flu pandemic in 1918 wiped out 20% of the world population. Exactly. COVID-19 has, you know, killed many people, but it works out 0.08% of the world global population has died from this pandemic. So
not only that, the point is, like I said, I see the situation currently in India, because India is you know, on a radar now. Everyone is looking, and the people are forgetting their own odd timing, and they are just focusing on India. If you see what's happening in India, I see, and it's the government. Honestly, currently, I'm from that part of the world, so
yes, of course.
How they think. I see the policemen beating the people who are on the roads, and then beating with those logs and then sticks, and then not sparing them, and males, females, girls, kids beating outside. I don't think they understand the situation. If you see the HIV, I'll give you a best example. The HIV/AIDS started in 1981, and it's still there. We still have it in the midst of us. It's here till date. So you can count from 1981 till 2021, it's been 40 years, right? So we have HIV/AIDS from 40 years and 35 to 40 million cases as of now. 40 million cases. We have it within us. Now, we are overreacting on Corona. We are overreacting. Yes, we need to take precaution.
Yes.
The distance we can keep absolutely, you know, acceptable. Fantastic.
Our last talk, when we were speaking about leadership and innovation, and we spoke about education, and again, it is that, you know, if we could look at, you know, measures in infection control and how to kind of look at basic nutritional practice, basic, you know, hygiene standards, you know, basic kind of leadership skills, you know, like you say, in terms of kind of how to effectively manage. But I definitely feel when we look at the global infrastructure when it comes to this, it has ravaged our economy, but from a point of, like you say, there has been an overreactance in it. And in the UK, we have had this being in lockdown, locked in the house, to then being released again, to then seeing a spike because you're starting to engage again, to be then locked down again, and this pattern is repeated. Now in Scotland alone, last week we've just came out of lockdown since Boxing Day. So, you know, there has been a surge in our economy because, you know, people are starting to be, you know, spend in a different manner. They're starting to be able to kind of engage, like you just said, in that person face-to-face environment. So we can't digitalize everything.
I agree with you. So the thing is that if, like I said, not meeting people is not the solution. Yeah. It's not the solution. Now, coming to the masks, you know, we have been asked by the authorities, and like I said, if you know, this is for the viewers and the people who listen to this, the masks are not going to save you.
Oh,
They're not going to save us. You can ask any renowned doctor in the world, anyone
yeah,
in the world, except those YouTubers and people who are on social media giving their personal views and stuff like that.
yeah.
Taking masks. If you see nowadays, you have the world on your fingertips. Just go to Google and just type in
Mm-hmm.
the size of a virus is 125 nanometers, and the pores in the masks is bigger than that.
Yeah,
Okay,
absolutely.
mask designed on the face of Earth by now, people who can or that can stop virus to go in. It decreases your immunity when you're putting a mask on.
Absolutely, because you're inhaling back
Exactly, you're
into you what
breathing,
you've inhaled
you're
out.
leaving, you're releasing carbon dioxide, and then when you have to
Mhm.
get oxygen, you mix the carbon dioxide and oxygen gets mixed because it doesn't go out fully.
Absolutely.
The people, believe me, the people with asthma issue. I have my own couple of friends, believe me, because in Dubai, we are free. We are free. We don't have restrictions except that you need to be in the mask. But the point is that I have my friends, couple of friends who have asthma issue, and believe me, when they walk for 5-10 minutes, they have to take mask out because they can't breathe.
Yeah.
And
Yeah.
scientifically, we live in a scientific era. Scientifically, it decreases your immunity. You cannot keep your mouth covered all the time. The people, okay, well, me, I'm working from home. I'm sitting in the office. I take my mask out. But the people who work 7 to 8 hours a day,
Yeah.
No.
I'm gonna
difficult. The pandemics we have seen these pandemics before. I think we are overreacting. We need to just stay calm, face it, people-to-people contact within the limits. Now, we had the third plague, which took 20 to 15 million people. It was a death toll, 12 to 15 million, 1855 to 1860. It remained for 5 years. So we have this time, if you go to the history, you have the Hong Kong flu. The death toll was 4 million globally, 1968 to 1969. It was for 1 year. Then you had flu pandemic, 1889 to 1890. Again, it was for 1 year, 1 million global deaths. So I think we need to just calm down ourselves, focus on a business, try to do it in a restricted way. But you can't just isolate yourself and put yourself in the cave and sit and
I agree with you. So it was interesting. You messaged me the other day being like, I didn't know you had COVID, and it's something that I don't make a big deal about because for that reason it is overreacted. But I was very sick with it and still am ongoing respiratory treatment through hospital. But I feel it is one that, again, had it been managed properly, and I was wearing a mask a lot during that time. I was out doing some support and development work, in the health and social care sector in the UK, and was in close proximity, but wearing a mask constricts your immunity further. And I totally agree with you. So my case of COVID was severe. However, there's many people who haven't had severe cases, and again, through this overreactance, we need to start engaging again. So I want to ask you, what do you feel needs to be done for a business to survive COVID?
Well, there are certain precautions, like I said, that we need. Sometimes we are forced to change, and that's exactly what is happening currently. But like I said, we are forced to change, but at a certain with a certain pace, at a certain speed. There has been enormous efforts have been utilized, tested about the current.
Yeah.
So I would say that we can go digital solutions, which I previously mentioned as well. But we know that there is a certain thing we can do, and there are certain things where we can have the personal access to get the things done. Like, for example, you need to buy a grocery, you need to, during this, it was reported in the Arabian Business magazine that UAE, only the United Arab Emirates, 560% surge in online grocery searches in April. 560%. Okay.
Wow.
These are the things when you say that go online, we want to go digital. These are the things you can do, but there are very most important things you can't do you can do sitting at home, but it doesn't suit the requirement.
Yeah, long term.
Shopping. You don't need to go to the shopping mall. You don't need to go to such crowded places just to buy, kind of stuff. Then you can maybe reduce the manpower. Okay, you can kind of, for example, you have 20, 30 employees in the company. Every company has an extra manpower all the time. You can
absolutely. So that can be streamlined. Absolutely.
Exactly. So that we don't have too much of gathering. Now, according to the 88% of the consumers trust word of mouth recommendations from people they know, while another study indicates offline word of mouth can increase sales by about 20%. So these are the things you do online. Like I said, when you want to buy something, you want to sell something, then yeah, okay, this is perfectly fine. But our world currently does not stand on selling and buying only. We have other things. We have the communication. We have the interactions. We have the people meetings. We have many things happening apart from that. We don't live in cryptocurrency. You have people want to go on cryptocurrency stuff, online trading and stuff. But I personally see a world out of these things as well. There is a world out of these things, I think. And then, be agile, be quick when it comes to coordinating in a moment. You can. These are the couple of things I would like to say that can be done, to survive in the COVID. But again, it comes to the point that let's not panic, let's not overreact. We be in restrictions. That's absolutely fine. We keep the distance and we focus on what we have been doing. For example, I didn't do a project since 1.5 years. I mean, people gathering because I do public training. So I don't have online trainings. I don't have that segment. I do public training, book a 5-star hotel. I bring the crowd and people have been scared. I mean, well, I want to tell the viewers and my friends who are listening to this that there's nothing, if COVID has to, believe me, get into our life, there is nothing that the virus. Yeah. It has no restriction.
Absolutely.
You wear a mask, whatever you wear, it's not going to stop. And I have a question. Many people, we have been suffering that we don't have the COVID vaccine, and we just got it until recently. We didn't have any treatment, and yet the people who had COVID, they went to the hospital, and the hospitals and the healthcare show the recovery rate. I don't know how they are getting recovered when we don't have the medicine.
Yeah, I agree with you in that sense. So I have not had a vaccination, and my personal views, I don't want to get into much, but I don't want one. That's my view, for the simple fact I've had the virus. I've built an immunity. I'm ongoing kind of treatment. My immunity isn't great, and when we're injecting someone back with live virus into them, it's going to make me sick again. So that is my personal vibe on that.
I agree on that. I didn't do the vaccine, and because I know the vaccine is on a trial now. Globally, there are only 2 vaccines.
But I want to come out and see you, in the summertime, and for endeavors and good times. But then I'm like, do I have to have a vaccination? And you're like, it should be our human right and our choice.
So the point is, see, you can't. You are helpless there. You have to take it. What I'm trying to say is that it's on trial. You know how many people died because of the blood clotting and the vaccine?
Yeah, exactly. AstraZeneca had massive fallback on it.
Denmark already banned the vaccine. It already banned.
Yeah, Germany as well, Poland
as well, Poland as well, Finland as well. Exactly. Now the point is that we have, like I said, I was listening to the doctor in Boston who was working with the Chinese lab since 2002 in the same lab when this vaccine was the virus was created. He said that the best thing to kill the vaccine is to inhale or to drink hot liquid.
Yeah.
I recommend everyone, even I was talking.
Absolutely. And it's funny, I have a family member who works in our health services, and she actually said antiseptic mouthwash and salt water. She was like, well, And, and there's been studies as well in relation to vitamin C, but we could talk all day about this, Shawkat. I really could, but it has been an absolute pleasure as always talking to you.
All the time, thank you.
So guys, you can catch us again next Sunday. Sunday?
Friday.
Friday, next Friday, sorry. On Shawkat's amazing YouTube channel and on over social media platforms as well. But until then, next week, stay blessed, stay safe out there.
Thank you, Naomi. Wish you a lovely time. Take care of yourself. Have a good time. Bye-bye.